fixing backs and dropping facts.
That's right, son. You're so good, man. You're so good.
Too easy, man.
I know,
Too
right?
easy. Hey, y'all. My name is Kai Blake.
And I'm Tom Larson.
And we are the boys
of
Bass, coming at you like Tamakaze, fixing backs and dropping facts. This is episode
14.
14, the big one.
Ooh,
4, man.
Come on,
Goodness great. A lot has happened since then, man.
Listen.
We had to take a little hiatus a little bit. Had to get back on the rocker.
Yeah.
We're back moving again, though.
But, dude, I'm crushing it, man.
Yeah. Hey, man.
Heart attacks are still last month.
I know, right? Easy.
Listen, I'm back on the bike doing Tabatas. Same
thrusters.
Same thing I was doing before my heart attack.
Mm-hmm. CrossFit workouts, like nothing ever happened.
This daggone vest, though, man, it's holding back.
Yeah, insane. But you're still doing stuff, just setting it off every couple of days just to make sure it works.
Heart rate gets up over 150, thing goes off, man.
Testing the limits, man.
On.
Make sure the device is legit. That's it. You just make sure it still works. And yes, it still works.
Only 2 more months.
That's it. There we go, right? We'll keep on testing it every day,
but
man.
Listen, a month into this thing, dude, I feel like awesome. I feel like
great.
amazing.
Hey, man.
I just did squat cleans with 165 today.
Jeez. Ugh. I don't think I could do that. I don't have a heart attack, so you got it.
But then I did get my heart up on the Metcon.
Yeah.
I was trying to keep it low. You start getting these Metcons.
Yeah.
You know, that 12 minute or so, 10, 12 minute of it, man, that's when my heart rate thing's going off.
Starts getting crazy. It starts getting insane in the membrane.
Anyway.
Yeah. So what we talking about today, Tom?
We're going through this process, a rehab process, and we've been talking about the hip. We talked anterior, posterior, or anterior lateral hip.
Yep.
So today we're talking about posterior hip pain.
Oh, yeah.
Commonly, I think, is referred to as piriformis. I got a piriformis issue.
Yeah. Very common. Usually the people will call it piriformis, sciatica, always some kind of thing that's going on in that back hip kind of thing.
I'd be like, flex your piriformis.
Yeah, show me, Harry, which one? And here they see that Dr. Google, man. That Dr. Google is tell you everything. Piriformis, where is that? Where is that? Point to it. That's right there.
One of those deep 6 rotators.
Yes.
And can cause some sciatica issues,
for sure.
Right? But sciatica is an umbrella term. You know, people come in and go, I got sciatica. Well, that just tells me you have pain going down your leg.
That's all it is.
I mean, I have a vehicle. Okay, do you have a car? Do you have a truck? Do you have a Ford? What do you have? Right. So sciatica is kind of an umbrella term.
Right.
True sciatica, yes, pinching on the sciatic nerve, going down there, but there's other things that can shoot stuff down your leg too.
For sure.
Doctor hears that, hey, pain going down my leg, sciatica. Oh, sciatica. Yeah, I got sciatica.
I don't know how many times they come in there, and that's the only thing they have. Treat, evaluate, treat, sciatica. And it's like, what's going on? Oh, I have this. Sometimes it doesn't even present like sciatica. And you're like, where did they even get that from? But all right, whatever. I don't have
pain going down my leg.
Yeah, that's it. Pain down my leg. That's it. So we go.
But yeah, that piriformis, interesting muscle. On some folks, the piriformis goes over top of the sciatic nerve, and then some folks, the sciatic nerve actually splits the piriformis.
Right through it, yeah.
Right, so it can cause a lot of problems, especially when it gets tight. It'll bind down onto the sciatic nerve, and pain go down your leg. Right, but just the issue is this deep rotator cuff-ish of the hip. You know, not exactly a rotator cuff, but the deep 6 rotators. Usually these patients have limited rotation in their hip. They have pain like walking, stepping, landing.
Weight bearing on that leg.
It's got to stabilize that so that muscle tightens up and moves down there. But the treatment process, man, get in there and massage that thing.
Oh, yeah, deep tissue too. Not that fluff stuff. Not that fluff stuff.
But because these are deep.
Yeah. So deep 6 external rotators. Not on the fascia on the outside. You gotta get elbow.
Right. So again, we give our patients that lacrosse ball. Have them start rolling that thing out. But then you got to remember too that the piriformis, that deep 6 rotator group, feeds into some of this ITB stuff. Hamstrings will end up getting locked down a little bit. Maybe some groin adductor issues. So we do the jaws. We call it the jaws recovery thing down your leg. Maybe a little hypervolt, like massage gun type thing. But anything to get deep into those muscles. Yeah,
and it's hard because a lot of times, like I said, people get on these things, they start, I didn't know that was even, I wouldn't even know to go into this area because it's just like, I know it's down my leg, I don't get it, I'm feeling it down my toe, all this stuff. But like I said, the deep tissue, man, it's not comfortable more times than not, especially if they're doing it correctly. Sometimes it's not the most comfortable, but it has such great relief, man. Such benefit toward it afterwards.
I mean, it doesn't hurt my elbow.
Oh yeah, my elbows are fine. As long as they ain't wearing them old jeans that scrape it. Oh
yeah. Jeans are bad.
Jeans and zippers, man. As long as it's not one of those, I can get in there. Buttons, jeans, and zippers. But yeah, man, those things. I'm telling you, it's a godsend when you go into and you get that deep tissue in there. And sometimes you do it's like a nerve floss and kind of thing. Get the piriformis and get that muscle, lock it in, and perform. Go through the movements, external rotation, internal rotation. And move it around. And like I said, a lot of times some people just light up. Like that's it right there. That's it right there. But you know, you got to go through that to get that relief you're looking for. Short-term discomfort for long-term gain.
Yeah, once we release it, once we do our fascial manual release on that, then our next step is to activate it, right? So, and we just don't know how to use our rotators. Or, you know, if I tell people all of that, I'm like, hey, flex your gemelli.
Yeah.
I didn't even know how gemelli. How embarrassing, you have superior and inferior gemelli. You didn't know
How
that?
do you
That's
not
very,
get
very
this?
embarrassing.
Engage.
Right, so we go through some activation exercises to wake up the peripheral muscle, the deep six rotator group.
Right.
They're not just the peripheral muscle. Sometimes that glute med medial can be problematic. Sometimes the obturators gemelli can be problems too. So we wake those guys up with some of our activation exercises.
Right.
Once we wake them up, final step. This is always the hardest part. Update that computer.
Update it, man. That takes the longest, man. It's awareness, knowing when to get it, how to engage. I was just talking to somebody the other day, man. Like when people throw out their backs or they injure something, it's not from picking up a car or something. It's like picking up a pencil because your body is not engaged. You're not engaged in that moment. You're not trying to, all right, let me engage this muscle and then perform the movement. It's just, oh, you know, it's arbitrary. Let me just move it up real quick and then locked out. So it's the muscle, man.
Rarely do people hurt themselves on max lifts.
Oh, never. Yeah, rarely.
Because they're always bracing.
Mm-hmm.
You know, it's
they're anticipating it.
Right.
They're anticipating
and
it.
They brace it, and they know that they're supposed to do this, and they're supposed to engage this and this and this. But when it's a pencil or paper, it's like the world's heaviest paper.
Oh my God! It's embarrassing to tell people like, oh, what were you doing? How'd you throw out your back? Oh, you know, I'm picking up a piece of paper the other day, and they're like, wow, a piece of paper must have been a bookload of it. No, it's just one slice. But yeah, no, that's the common thing, man. So it's like I said, you can't. And unfortunately, it's repetition. You know, so I could tell you every day or once a day and be like, hey, yeah, you just got to engage. But unless you're doing it regularly and practicing, and that's where therapy comes in the hand. Like, hey, when you're doing that movement, we can kind of look at it and say, hey, you're not engaged, or you'll have feedback like, oh, it hurts when I do this. Oh, there's a muscle that's not being engaged when you're doing it. That's why.
Well, you know, I've been married for going on 25 years.
Goodness,
right? I know, right?
A quarter century. Good.
My wife's got me trained. I lift the toilet seat, right?
He's domesticated.
But I deadlift the toilet seat, right? Here's how I do it. I get up to the toilet seat, I'm like,
never throw your back out, right?
So, you know, I deadlift my toilet seat, I deadlift paper off the ground.
That's it, man.
Don't hurt yourself,
yeah, man. And it's like I said, it sounds silly and everything, but it's the truth. You might not have to do all that, but but you should. Like I said, it's one of those things that just you naturally, when you're going through the motion, engage that muscle. And it's crazy because, like I said, you go through and it's squeeze your glutes. People don't know how to do that. They don't. It's not a common thing for people to do that. And so you come in here and you see that, and that you see the response they have when they're doing certain motion, like, oh, it hurts my back when I do that. And you're like, well, you already squeeze your butt. What do you mean squeeze my butt? Like, you know, squeeze your glutes. Squeeze. If you didn't get whoopings as a child, you must.
You know, I think another cue is to screw your feet.
Yeah.
Like really try to screw your feet into the ground. You use those external
sure.
too. So,
yeah.
But yeah, that's the thing is, you know, once we massage it, we activate it, then we got to update it by doing those kind of things, right? So we'll do those functional type movements.
For sure.
Retrain the brain, because the brain is going to figure out a way around this issue of pain or damage or issue and do something else in order to survive, but that can cause more issues. So we massage, we activate, update the computer again.
For sure. Repetition is the father of learning.
So just like our other areas of our body, man, the same process. Massage tissues, activate, stabilize, update the computer.
Okay, yes, listen. We gotta reinvent the wheel. Just do what works.
Follow the process.
Follow the process. Trust the process.
Until next time, go out, live, work, and play better inside your body. Peace out.
Peace out.